Almost every injury we have to have a CT. Any head injury, however trivial it is, we always do a CT. Not only head injury, spine, chest and other things, abdomen injury, any trauma, however trivial it is, we have to do, because it's a non-invasive procedure, we always investigate.
According to the Ministry of Road Transport and Highways here in India, there are 17 deaths every hour due to road accidents. Along with the highest stroke rates in the world, trauma injuries are a serious problem. One key piece of technology that can mitigate this collateral is computerized tomography, or CT. But historically, access to such critical equipment has been difficult, especially in areas outside of major towns and cities. However, in 2011, 75 engineers at the Innovation Hub in Bangalore, working with 500 healthcare providers, came up with a solution, and it's called the Revolution ACTS, or REVAX for short. This is Dr. Sundar Rajan's clinic, and he decided to invest in the REVAX capability for his local community. Dr. Rajan, however, due to COVID, is caring for his patients remotely. There we go. Right, recording on audio, I'm recording on this, I'm recording on you. Dr. Rajan, this is a real sign of the times. It's a first for me. I'm actually sat in your clinic in Salem while you're remotely caring for your local community from home because of COVID-19. How have you had to adapt under the global pandemic?
This pandemic, it is a very infective virus going around. So we have to take all the precautions. At the same time, we try to help the patients and see that their clinical services are maintained. You can see in front of you the computer workstation is an MRI workstation, which we are using for the purpose of this video conferencing with patients also.
How has this new way of working affected you when it's come to trauma patients or stroke patients, for example?
We offer all forms of clinical service in neurology and neurosurgery. Here, we have a set of other young junior doctors, neurosurgeons, physicians, and others in the hospital. I am just guiding them through these equipments. We see the same number of patients as we were seeing even or before this pandemic.
Why, Dr. Rajan, did you invest in the computerized tomography here in Salem for your local community?
It is because of the accuracy of diagnosis, convenience, and quick form of treatment to the patients. This CT has revolutionized everything. CT MRI has changed everything.
How many patients are benefiting from this in Salem?
In our hospital, we do about, CT alone, we do about 500 to 600 patients every month.
What do those patients usually consist of in terms of their injuries?
Not only injuries, nowadays in this pandemic, even for Corona CT, chest CT screening and all, we are using it. So now actually the work has doubled because of all this. We are able to manage because of the Revolution ACT. It is a very fast machine. It quickly does the job.
If your Revolution ACT wasn't here at this clinic in Salem, where would your patients have to go to get the treatment? How far would they have to travel?
Nearest will be either 200 kilometers Bangalore, 160 kilometers Coimbatore, 300 kilometers Chennai.
Dr. Rajan has now said I can very kindly go to the neuroscan department. I'm going to meet Senthil Raja. He's a customer services specialist for GE. He's going to introduce me to one of the patients. Senthil, hi. Hi, namaste. Yeah. Namaste. So Subha, how has having access to this hospital and this equipment improved your quality of life?
So இங்கே வந்து நல்லா பார்க்குறாங்க, கேர் பண்ணி பார்க்குறாங்க சார். வந்த உடனே பார்த்துக்கலாம், வெயிட் பண்ணணுன்றது இல்லை. மற்ற இடத்துக்கு போனால் அங்கே வசதி இருக்காதுங்க. வெயிட் பண்ணி ஒரு நாள் 2 நாள் ஸ்டே பண்ணிட்டு தான் நாங்கள் பார்த்துட்டு வரணும்.
Dr. Rajan, how old are you?
I am 70.
Is there any idea of retiring in the near future, or are you're not even thinking about that yet?
Maybe another 2 to 5 years I will work. I help this community to overcome this pandemic and sort it out. Maybe I can retire after that.